Hello there. I'm Dr. Sonal, and these are my opinions. They do not represent the medical community of which I'm a part of, and they do not represent the views of my organization. Thank you. Hello there. I wanted to talk to you a little bit about COVID symptoms today because the landscape is changing as far as what we think might be related to it. And everybody wants to know about COVID toes because doesn't that sound interesting, COVID toes? Unfortunately, it is a little interesting. Um, so the toes with COVID disease that we've realized are related, a lot of times the patients that we've had personally that I've seen, they have had these toes, but not with significant symptoms, and sometimes even after they've had their cold symptoms. And we think what it feels like is usually burning or tingling, or like their foot's asleep, or their toes are asleep, or something in like that area. But it's usually red and very sensitive to the touch. And we think it's microvascular or like mini blood vessel things that are going on that are causing them problems, potentially even maybe clots. We're not sure exactly what the pathophysiology is at this time or mechanism is at this time. But if you have toes that look like that, even if you don't have any other symptoms, call your doctor and just make sure you get an evaluation plan from them, depending on what that might be. So if you have toes that look like that, what are we calling COVID toes, which are red and sensitive, please go ahead and give them a call, especially if it's a new finding. Mostly mostly the patients that I've seen have been several toes, but we have had one patient that has just had one toe that I know personally. And so there's rarely people that are in the ICU with toes that look like this, and these are not the people I'm talking about. Obviously, if they are in the ICU, they're sicker from other things and have been brought to your attention. But I'm talking about just only those toes and nothing else is going on. You feel fine, still call your doctor and get checked out.